Pramoxine-Zinc Oxide cream is used to temporarily relieve itching and pain caused by minor skin irritation such as minor burns, cuts, scrapes, sunburn, eczema, insect bites, cold sores, or rashes from poison ivy, poison oak, or poison sumac. It may also help with discomfort from hemorrhoids and certain other problems of the genital/anal area. Pramoxine belongs to a class of drugs known as local anesthetics, which means it numbs the skin to block the feelings of pain and itching. This cream may also contain other ingredients including skin protectants such as calamine and zinc oxide. It is important to read the package instructions carefully before using this product to make sure it is right for you. Do not use this cream for skin irritation in children younger than 2 years or for hemorrhoids or other genital/anal conditions in children younger than 12 years unless directed by a doctor. When using Pramoxine-Zinc Oxide cream, make sure to only apply it to the affected area as directed by your doctor. Avoid using it on severely broken skin areas such as open wounds, deep cuts, or serious burns. If you're self-treating, follow all directions on the product package, and if you have any questions, consult your doctor or pharmacist. Gently clean and dry the affected area before applying the cream. If you're using a lotion, spray, or foam product, make sure to shake the container well before using it as directed on the label. For skin irritation, apply to the affected area usually up to 3 to 4 times a day or as directed by your doctor. For hemorrhoids or other anal conditions, apply the medication to the affected area usually after each bowel movement or up to 4 to 5 times a day, or as directed by your doctor. Do not use this medication inside the rectum. If you're using the hemorrhoidal cream, you may use the applicator that comes with it, and remember to clean the applicator after each use. After using the cream, remember to wash your hands immediately, unless the area being treated includes the hands. Do not use this product on large areas of the body or use it more often than directed. Avoid covering the area with waterproof bandages or plastic, or applying heat unless instructed by your doctor, as it may not improve your condition any faster and may increase the risk of side effects. Avoid getting the product in your eyes, nose, ears, or mouth. If the medication gets in these areas, wipe it off and rinse right away with water. If your condition worsens, if symptoms do not improve within 7 days or last after 7 days of treatment, or if symptoms clear up and return in a few days, stop using the product and consult your doctor. If you think you may have a serious medical problem, seek medical help right away. If you experience burning or stinging after using Pramoxine-Zinc Oxide cream, it's important to let your doctor or pharmacist know. However, many people using this product do not experience serious side effects. While a serious allergic reaction to this cream is rare, it's important to seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's best to contact your doctor or pharmacist for advice. When using Pramoxine-Zinc Oxide cream, it's important to follow your doctor's instructions and remember that they have determined the benefit to you is greater than the risk of side effects. In the US, you can report any side effects to the FDA, and in Canada, you can report them to Health Canada. Before using Pramoxine-Zinc Oxide cream, be sure to talk to your doctor or pharmacist if you are allergic to pramoxine or any of the other ingredients in the cream. It's important to check with your pharmacist for more details about the inactive ingredients that could potentially cause allergic reactions. Also, make sure to inform your doctor or pharmacist about your medical history, especially if you have deep, open, or puncture wounds, broken, damaged, or blistered skin, or if you have had animal bites or serious burns. If you are using this cream for hemorrhoids and experience bleeding from the rectum, stop using it and consult your doctor right away. Before undergoing any surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, use this medication only when clearly needed and discuss any potential risks and benefits with your doctor. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. Be sure to follow the recommended dosage and use Pramoxine-Zinc Oxide cream as directed by your healthcare provider for best results. When using Pramoxine-Zinc Oxide cream, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's also important not to start, stop, or change the dosage of any medicines without your doctor's approval. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it is important to call for emergency medical assistance immediately. U.S. residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to their provincial poison control center. Make sure to keep all of your medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to stay on top of your appointments to ensure you're getting the most out of your medication. If you are using this cream on a regular schedule and forget to apply it, use it as soon as you remember. If it is close to the time of your next application, skip the missed dose and continue with your regular schedule. Do not apply double the amount to make up for the missed dose. Make sure to store Pramoxine-Zinc Oxide cream at room temperature. Be sure to check the product package for specific instructions on how to store it, or ask your pharmacist for guidance. It's important to keep all medications out of reach of children and pets. When you no longer need Pramoxine-Zinc Oxide cream or when it has expired, make sure to properly discard it. You can consult with your pharmacist or local waste disposal company for the best way to do this. Remember not to flush medications down the toilet or pour them into a drain unless you have been specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.